So my name is Ai-Lan. I'm a neurologist and I did my training here in Melbourne and then finished it in London when I went across there. And then I decided that I really enjoyed multiple sclerosis and I wanted to do a fellowship overseas. So I went to Vancouver at UBC Hospital, University of British Columbia, and did a 1.5 year fellowship in multiple sclerosis. I found that I really enjoyed research. I wanted to go back home and to do both clinical and research work. So I came back to Melbourne, fortunately joined up with the Royal Melbourne Hospital crew, and then decided I would do a PhD. So I joined, I joined the core group here on the basis that I had a clinical background in neurology, but I was very interested in pursuing research in connection with that. So it was a good mesh of the clinical and the research world, especially from a statistical point of view. And Thomas is one of my supervisors, so that also led into the group. But halfway through a PhD at the moment, with 3 interconnected but slightly different topics that I'm working on.
Okay. Can you tell us about those topics?
Sure. So the first part is looking at whether we can use brain volume in the clinical setting. So currently it's used in the research world. We know that a normal person's brain ages with time, but an MS person's brain ages faster, so anywhere from 2 to 3 times faster. And that with certain medications, the shrinkage of the brain, so the brain volume loss, can be similar to normal aging. So what we hope what people have looked at is measuring the brain volume in patients to see whether medications are potentially at their optimal, or if the patient needs potentially other medications. The problem is that it's very difficult to measure brain volume in a clinical setting, and it's not something that patients routinely get, because it's very, very, difficult from a physics point of view to integrate that within the time frame that patients get the scans. So we are trying to see whether or not we can work with a commercial company that does brain volume measurements to integrate it into the clinical setting, so that when physicians or clinicians see patients, they actually have that measurement of how much the brain has changed every year. So the first part of my project is sending a lot of scans that have been done retrospectively to this company, Archimetrics, to see what the measurement error is. Because patients are getting scanned on different scans, which makes it more difficult to measure that brain volume, what the error is. So we'll be seeing whether or not we can accurately measure the brain volume, what the measurement error is, and whether we can integrate it. So that's the first part. The second part is a long-term study to try and see what is the best measure of disability, but something that can be done in clinic to be able to predict where someone will be.
Okay.
So there's a long background at the moment. We don't have a great way of predicting how someone's disability will be in the future. We use a combination of new lesions on the brain, whether someone has had a relapse, or if the examination changes, so whether disability increases. The problem with all of these is that we're reacting to something that's gone wrong, and what we want to do is to try and pick it up before it happens. So what we're proposing with this study is to use what we call subclinical measures, so things such as thinking tests, walking tests, arm tests, to see whether if any of these change with time. So looking at their trajectory over 5 years, if there's a subtle change, whether that will predict how someone will be in 5 years' time. And we're also including brain volume in that as well.
Okay.
So that's a 5-year prospective study. It's the second part of my project. And then there's a third part as well, so it's an ambitious PhD.
Yeah, definitely.
Third part is looking at pregnancy and MS. So in particular, I'll be looking at whether pregnancies before someone's diagnosed with MS is beneficial to the course of MS, i.e. delays the onset of MS. So pregnancies done a full 360 in the last 10, 20 years, and they used to think pregnancy was a bad thing for women with MS, and they used to be counseled not to have children. And then we found out in the late 90s that actually when someone has MS and is pregnant, there's actually less relapses compared to not being pregnant. So it's not a bad thing. What we don't know is the long-term effects of pregnancy. So there have been some theories that pregnancy before MS is a good thing. It delays the onset of MS. But there are other studies showing that it doesn't have any benefit. So what we're doing is we're surveying all the women who come through here, MS clinic and other centres in Australia and also overseas, to have a look at the pregnancies that have occurred over their lifetime to see whether it does potentially delay the onset of MS, because that will potentially help with counselling. So they're the three parts of my PhD.
You're certainly not taking on a small amount of work in a PhD, but work that sounds like it has potential for some real benefits for people with MS in terms of, with the second arm that you were talking about, the uncertainty of living with MS is something that people constantly talk about as one of the biggest difficulties.
Exactly. I think that prediction of disability is one of the most important things, because it's a disease without a cure at the moment, and I think that will come soon, sometime in our lifetimes, but for the meantime we have a lot of patients who come and say, how am I going to be in 10 years' time? At the moment we just don't have that crystal ball to tell them, so this will be a step closer towards that.
Okay, fantastic. And being a year and a half into the PhD now, how are you enjoying it? It's been I really love the PhD. It's great. So I'll start off with that. Yeah.
It's the process, I think, is very important. So going through obviously ethics submissions and then governance and then learning, the process of that I think is what a PhD is for. So I think that's been challenging, of course, getting the ethics and the governance through, but it's what research is about. So you have to accept that you have to go through the steps, and then the fun comes once you've got the results. So it's been a very educational process, but I'm very glad I did take that journey, and I'm still. I guess it's probably better to say that once I've finished the PhD. But I'm enjoying it at the moment. It's got its challenges, but none of that I guess we won't be able to deal with.
And so, what are as a last sort of question? What are the biggest benefits about doing the PhD in the core unit? How have you found the core unit to be part of so far?
Yeah, it's a hugely supportive unit. It's a great, group of people here with diverse backgrounds. So we have clinicians, so neurologists. We also have people with statistical backgrounds, neuropsychologists, a lot of interest in neuroimaging and statistics, and also we have overseas. People coming and joining temporarily the team as well. So everyone brings with them their own, obviously, expertise and skills. And it's great being able to share that knowledge around, especially for me if I'm deficient in certain statistical skills. There are people around to help. So it's a very supportive environment. Everyone's great, and the skill sets all combine, I think, very well to help anyone who's doing research kind of on that journey, whatever that it may be. And also, obviously, other subspecialties, not just multiple sclerosis, so within the MBC. It's great collaborating with other units and hearing about their projects, potentially helping with any statistical methodology needs to be done. So it's very rewarding, and as I said, it's a great team, so it makes it more fun to come to work every day.
All right, fantastic. Well, thank you very much for your time today and sharing with us your PhD journey and your research that it's on. It sounds like really interesting work, and we look forward to hearing more about it in the future.
Great. Thanks, Fred.